I think we actually are ready to get started. We are really pleased to have Rowena Magana here today to go over the key points of AB210 multidisciplinary team. We have at CSH with LASA, Shelter Partnership, United Way, we've actually been piloting an AB210 multidisciplinary team for older adult and homeless service providers. And we've been very excited about the results of that. We're hoping to keep it going. And so today you'll learn more about what it entails to become an AB210 provider and how you might be able to join our AB210 team. We are not going to do formal introductions, but if you wouldn't mind putting who you are and your organization in the chat, that would be great. Okay, with that, I'd like to turn it over to Rowena. And Rowena, I guess you're going to run your own PowerPoint, is that right?
Yeah, I can do that. Let me start by sharing my screen and seeing if I can do that. Is it working?
We're seeing
yes, your screen. Are you able to see it? Great. Oh, let me fix that. Okay. Hi, everybody. My name is Rowena Magana. I work for the CEO's Homeless Initiative team. I've met some of you, but I don't think I've met all of you in this meeting. But I'm here just to talk about the legislation AB210 that was passed recently, and also see if any of the agencies on this call would like to participate. So get the next slide. And I'm gonna probably just look at this screen because I have two screens going on over here. So this AB210 was established and became effective in January of 2018. And it was an LA County sponsored bill. What it does is authorize counties to establish homeless adult and family multidisciplinary teams. So MDTs for short. And the purpose is to expedite identification, the assessment and linkage of homeless individuals and families to housing and supportive services. So it authorizes MDT members to share information, and really we're hoping that it will help with the coordination of housing and support services, increase continuity of care, and also just decrease unnecessary duplication of services. And I also have a note there, when we're saying MDT, we're not necessarily meaning like the outreach teams. This is in the legislation, it just calls them multidisciplinary teams. That's just, I'm picking up the wording from the legislation. So right now, this list right here shows all the county departments that are currently participating, and also LASA. So we have the CEO's office, DHS, mental health, public health, Department of Public Social Services, the Sheriff's Department, but only a limited amount of folks from the Sheriff's Department can participate, just the Jail in Reach program. LASA, the Probation Department, also just a limited amount of folks from probation can participate, just Super Connect. The Public Defender's Office and the Workforce Development, Aging and Community Services Department. So these are the county departments and LASA that are currently part of AB210. In addition, county departments, we also have agencies, community service providers that are also eligible to participate. So we have a lot of the homeless services providers, so CES agencies, other homeless providers that are in LA County. We also are inviting health clinics, hospitals, mental health clinics, older adult service providers, like many of you on the call, and also regional centers. So this is not an exhaustive list, but we wanted to start with these core groups first to encourage these agencies to join the AB210 training and program. So what information can be shared? So the type of information that can be shared is usually otherwise confidential under state law, but under this state law, we can share it. So it must be generally relevant to the identification, assessment, and linkage of homeless adults and families to housing and supportive services. Under AB210, when we say homeless, a family member or a person is considered homeless if they have self-identified as homeless within the last 12 months, or if any element in their service records indicates that they have experienced homelessness in the last 12 months. So as you might know, some of the different county departments and LAHSA, they all have different definitions of homeless. So if they're like sort of flagged as homeless in any of those systems, they would be considered homeless, and therefore you would be able to assist them through this legislation if they're flagged as homeless in any of those systems. Also of note is AB210 authority. It's a state law, so it does not supersede any federal laws or regulations. So for example, HIPAA is still, if your agency is covered under HIPAA, you should still abide by those rules and those laws. And so here's, this slide is really just has some of the that could be shared under AB210. So this isn't everything, but these are the main types of categories. So demographics, contact information, service and program enrollment, medical history, disability status, housing and homeless status, benefit history. These types of categories are types of things that can be shared via an MDT and are also available on the CHIP system. So in a few more slides, I'll explain what the CHIP system is. Other items that could be shared in an MDT team could be criminal history, probation status, domestic violence status, veteran status, and employment history. So if there's any, if it's not relevant to case, it doesn't need to be shared, but these are the things, these are the types of items that could be shared if it was relevant to the case. So we're very excited to share with you all that we have a system called the CHIP system, which is the Countywide Homeless Information Portal. It's relatively new. It's basically a query system that grabs information from different county department systems. So what it does, if you do the training, AB210 training, in addition to being able to form an MDT team, you could also get access to this CHIP system. And the CHIP system will pretty much grab information from what's available. So let's say if you were looking for a certain client, in the system, you type in their first name, their last name, and their date of birth. And then all the information that is available will be grabbed. So it's in real time. And it will show information like demographics, if they're enrolled in any programs through LAHSA agencies, if they are enrolled in benefits, for example, through GPSS, and how much money they are receiving through GR or CalWorks. If the person is enrolled in APS, Adult Protective Services, it would also return that information. So it doesn't have all of the different data elements from all of those systems. It has just some pertinent data fields. So oops, let me go back. So you can search for pertinent service history and status information, and it'll grab it if it's available from those systems. And so also important to note that CHIP does not store any information, so it is just real time. So every time that you close the browser, all the information is gone. And then when you open up the browser again, it'll pull it anything new. So if anything new happened, it'll be current. And it also is the sort of system that you don't need to input any new information. So it doesn't have like case notes. It's more of a read-only system. So I just wanted to point that out, that I know that a lot of agencies don't want to add another system because there's so many systems to check. But this one is more of a read-only system. So you can just check, if the client you're working with is already connected to services. And if, let's say, it shows that they don't have, they're not connected to any of the LAHSA providers, maybe that would be the first thing that you would work with the client. So that way, you can refer them to any new programs that they might be eligible for. And sometimes clients don't necessarily know which program they're part of. And so you might need to check the system in order to refer them back into a program and get them connected. Like, so for example, it will show like who the case manager is that the person is working with. So that way you can help with reconnecting the client if needed. So unfortunately, I can't show you the screenshots of the CHIP system since it's live and it has patient data in there and client data. So, but it is a system that you could get access to if you do the training. So in terms of next steps, in order to be part of this, there's 3 key documents that we would need from agencies. There's a protocol, and it sort of delineates what types of agencies can participate, what documents need to be signed, and methods of information sharing. And there's also the countywide policies and procedures, which is just procedures that all participating agencies must abide by. And then there's also department agency policies and procedures that if your agency wants to have your own set of policies and procedures, that's completely fine, and you may establish it. But what we ask from the CEO's office is if you could share that with us so that we can also keep that on file and just make sure that it's aligned with AB210. These documents are located on this website right here on the HI website. So you can, if you want to take a look at that, you can go ahead to that website and take a look. And so those are like background information, what I just described. There's also 2 documents that would be needed to be signed in order to get started. So the first is a participating agency agreement. This is, I think it's about 2 or 3 pages. It should be signed by your executive director or whoever has signing authority for your agency. And then the second document is an Excel document. It's really, it actually doesn't need a signature. It just lists out all of the different people that would need access to the CHIP system. So we need their name, their phone number, and their address. And with that information, you would send it to this email address, which is ab210@co.lacounty.gov. And we can process the documents and then send the training link to the people listed on that Excel spreadsheet. Let me think. Oh, the training. That training it's online. You can take it at any time. It's 80 minutes. About if you are a contractor. If you're a county employee, it's a little bit shorter. It's actually 30 minutes. But so depending on if you're a county employee or not, we'll send you the correct training link. But you can take it like on your cell phone or on your computer. It doesn't matter. It's sort of a link that's open for whenever you have the time to do it. And you don't have to do it in one sitting. You can also break it up if needed. Oops, keep on going too fast. I think that's my last slide. So if any agencies here on the call are interested in signing up, you can send an email, like just a general email to ab210@co.lacounty.gov, and we can send you those 2 documents to fill out. And that would be, it takes usually a few days to actually to process it. And so here's my contact information in case you need it. And maybe with that, I could open up for any questions. Hopefully it didn't go too fast, but let me know if you have any questions.
Any questions?
There were some questions in the chat. One of the questions was, what's the difference between CHIP and Clarity for HMIS?
Yeah. Let's see. So Clarity is the HMIS system, and so CHIP will grab information from the HMIS system. It doesn't have everything that's in the HMIS system. It has just some data elements, like for example, which program the person is enrolled in, the date of enrollment, their case manager, and some other demographic information. So it has like a subset of the information in HMIS. So if your agency doesn't have access to HMIS, this is a great tool to use because it will have some of the information about HMIS, as well as other departments. And I'm sorry, I can't see the chat. It must be what I'm looking at right now.
Thank you.
If there's other questions, could somebody let me know what they are?
We have a basic question about will you be able to receive these slides? And yes, everyone will get the slides and the recording also. I wanted to, it looks like that's the main question we got. I'm looking to see if there's any other, but I wondered, there's a couple of folks that are on the call that have actually participated in our pilot of MDT. I wonder if you could just give a little sample of what it was like for you and whether, how was it helpful?
Hi, Gretchen. This is Rosanelli. I can share my experience.
Great.
Initially, you know, the training can be a little challenging. We did have to go through some hiccups and get it resolved through our IT, but eventually we got it done. And coming from the health plan for us was a game changer because we were working in the dark, and like you have mentioned, that some of our members don't know which programs are enrolled and who's assisting them. That was challenging for us, but now that we have access to the CHIP system, it allows us to go back and see if they're already in the coordinated entry system, which agency has been working with them, so we can go back and reconnect them and really, you know, just avoid duplication of efforts. But for us, it has been a game changer.
Thank you, Rosanelli. And there is a question about the benefit of CHIP over HMIS. And I think your comments highlight that if an organization has HMIS, then that would definitely be a benefit. But some of you working in the older adult field actually don't have access to HMIS, and CHIP can provide some really good basic information. So
I think what's also really another benefit to the CHIP is that most other organizations, I mean, I can't think of an example that would have access to. Most agencies do not, unless you're part of the county, would not have access to DPSS information or WEDAX information. So CHIP gives that access. So if you are working with a client and you don't know what kind of benefits they have, or you know that something's wrong with their benefits and you need to fix it, it even says which office, DPSS office that person is receiving benefits through. That way, at least you can link the person back to DPSS and then work that out. And if, you know, for example, if you're trying to work with somebody to see if they're eligible for Social Security benefits, maybe you want to work with the CBES team, you can see what they have right now. And then that could help with the application. And since I'm talking about DPSS, I forgot to mention, and I do want to mention that we're going to have a new feature for the CHIP system that hopefully we'll be rolling out very soon, where you can print out the verification of benefits through DPSS. So it's something that you can, it's a PDF, you could print it out. And let's say you're working on an application like for housing. Generally, I think you would need that for housing applications like Section 8 or any rapid rehousing. And you need to show proof that the client has income. You can print that out and add that into the application. So we're very excited about that new feature that will be part of CHIP in the near future. But also just one caveat, it only shows general relief benefits. It doesn't have like CalWorks benefits, for example. That will be in a future phase. So we're hoping that this will be something that a lot of the case managers and social workers that would be able to use it to help move along applications for their clients.
So it sounds like when I'm hearing that it goes beyond, it might give you access to sort of a consolidated access to different county departments, which goes beyond HMIS. So that's definitely a benefit.
That's right.
And then we're getting, so I'll read off the questions. Can DPSS social worker be contacted directly through CHIP, or does the social worker still need to call the hotline? It is a huge obstacle in helping seniors apply to Medi-Cal or CalFresh. That's from Marissa.
So there isn't, through CHIP, there's no way of sending messages, so that wouldn't, there's no like capability in that way, but it would list out who the client is working with if you wanted to figure out who the eligibility worker at DPSS is. So so I think using the hotline would still be a good way to go. And I don't know if there's anyone on the line that might be from DPSS that might want to elaborate on that. Maybe not, but it's still, yeah, to answer the question, there isn't the capability on the CHIP system to do that. It doesn't have like an email or it doesn't have that functionality.
Hi, Rowena, this is Lois from DPSS. I just wanted to say that, our customer service center, if you call the customer service center hotline, they're now able to take applications over the phone for Medi-Cal and CalFresh. So it's when somebody calls in and they indicate that they want to apply for benefits, those calls get prioritized. And there's very little wait for applications. So I just wanted to share that with the group.
Great, thank you so much. So another question from Marissa, does CHIP differ in information provided about clients' case from the DPSS portal?
I'm not sure what, oh, do you mean the Your Benefits Now portal? Is that the DPSS portal you're referring to?
It's the portal that the client can sign into by providing their case number and social security number. So I'm not sure if that's the same as CHIP. And if it's not, what different information can you get?
It's actually, it should be the same information that is in the Your Benefits Now portal. It's all pulling from the same source system. So it's the same information, but a lot of times clients don't remember how to access that portal, I've heard. And so sometimes you need the case number in order to access that portal. So if you go to CHIP, that will be there. So sometimes, you know, if you're a case manager, you might go into CHIP just to get that information to help the client so they can go into that portal. But it's the same information and it's pulling real time from the same place. So so it wouldn't be in conflict. But the CHIP system is available to case managers and you know, and people that are assisting clients. That DPSS portal is available to the clients themselves. So since it's a different audience, that's why, I mean, that's why they're slightly different. They're different systems, but they're still pulling the same information.
Rowena, I have a question for you. Would there ever be the ability to enter the members if they are enrolled with a health plan, like for example, our members, would there be ever a possibility of indicating which health plan they're enrolled? Just because I think that's also very important. You know, a lot of health plans nowadays are providing case management services. They're working with community business organizations like LASA and other programs to help work together and address the housing insecure. And I think that's important if they are and have it on the CHIP system, or even there's some members that are, they have their Medicare enrolled with one health plan and their Medicare enrolled to a different health plan. And would that be something that you eventually be able to have in the CHIP system?
Yeah, that's a good question. At the moment now, we don't have that information since like, for example, Medi-Cal information is, I forget exactly how it works, but it's protected by the state. So then that information is not shareable at the moment through AB210 legislation. So therefore we can't have it on the CHIP. But it is something that maybe we could work out to see if it's possible in the future to have like certain access for healthcare providers, because then the healthcare providers would be covered under HIPAA and they could share amongst themselves. So that's kind of, we'd have to do some more research to see if we can, if that would be possible. But right now it's not available. And since HIPAA supersedes AB210, we have to, you know, abide by those rules at the current time.
Okay. We did get a request also, Lois Beltran can provide the hotline number in the chat. That would be lovely. So, okay.
Of course, I'll do that.
Thank you. Anything else for Rowena? Anything else? We've talked a lot about the data, but I do want to emphasize, I just want to remind people that it's also a great way to create a forum for team sharing. And that once you're in the team meeting, and you can do this virtually, as long as everyone is certified and trained, then you can really talk over the nuances of a case, do problem solving, make referrals to each other. So the data portal is wonderful and amazing, but also just the ability to actually create teams around your clients that are experiencing homelessness can be really a great benefit of AB210.
Yeah, we're wanting to sort of get the outreach out to more of the what do they call it? The case conferencing that losses usually has different case conferences calls that happen in the different spas. So we're trying to outreach to all the different agencies, because it's usually multidisciplinary. It has lots of different agencies that would need to share information, but usually you can't share too much. With AB210, you don't need to get a consent form for every client that you discuss. This legislation actually covers you. So if you're trained, you can go ahead and work on that client together. And it could be a structured case conferencing, like what we have been doing through CSH, where we meet once per month, or it could be something that you pull together MDT team for a particular client on that one day, and then it dissolves after you discuss the client. So it doesn't necessarily have to be, a case conferencing, scheduled every once per month. It could be something you can form an MDT team, for an emergency for a client and then dissolve it right afterwards. So I'm glad you mentioned that, Gretchen, that it could be the teams, and it could be also be, you can access information through the CHIP system, but we're hoping that the CHIP system would be like an added tool that teams could use in order to better assist their clients and mutual clients.
Yes, and I'm just putting in my email so that if anyone is interested in joining an AB210 multidisciplinary team, please do get in touch with me. We are, right now our pilot ends the end of December. So if you wanted to, December 21st, I think is our last day. So if you wanted to see what one was like, you could actually get certified really fast. But if you're just interested in learning more about how to join a team, then let me know and we'll put you on the list. So. And I can see the DPSS Customer Service Center number going up. So thank you. Okay, well, this has been short and sweet, but very valuable. So Rowena, thank you so much for taking the time to give us an overview. I would really encourage all of you on the call to get in touch and become certified, to work with Rowena on that. It really can be a benefit to your agency, and it helps us increase collaboration and information sharing among our Los Angeles agencies. So with that, we will sign off.
Gretchen, sorry, I'm sorry, in trouble. I have a question. This is Rowena. I'm a community worker for outpatient services for the LA Department of Mental Health. And I wanted to, I don't know if we're going to be able to get a PDF or a copy of the PowerPoint.
Yes, I mentioned earlier that everyone will get the recording and the PowerPoint.
Thank you. I think that's when I was jumping in. I got a call from my supervisor. I apologize for that. But
no problem at all.
Glad to have you. Like, I know we have Rowena's email here, and you said we can call you, Rowena, if we have some information or would like to participate.
Sure, yes. And I do want to mention, so Department of Mental Health is one of the entities that your executive director has already signed off on it. So now if you're an employee that hasn't received the training already, or maybe received it before, but hasn't had a chance to do it, we can resend it. So if you'd like, you can send an email to me. I put my email in the chat, or also the AB210 at ceo.la.gov. Both are fine. So I noticed that some folks on this call are already trained. There's some people that are trained already, and some have agencies that are already have the participating agency agreement signed. So it might be just a matter of filling out the Excel spreadsheet, which is so that we can actually process you and then send the training to you. So please feel free to send me an email, and then we can sort that out and see like where you are in the process.
Great. Okay, any other last minute questions? Okay, great. Thank you again, everyone. Have a great day.